Hello, welcome to my video on follicular study. This is a part of our series called Be Aware, Be Prepared, Be Safe. This is an initiative to enable informed decision making by patients. Some basic information about fetal and pelvic anatomy. A woman is born with millions of immature eggs waiting to be released from the ovary. During ovulation, a mature egg is released through the fallopian tube and is available for fertilization. Since an egg and sperm fuse to form a baby, to prepare for the same, the uterine walls also thicken in anticipation. In the event that no conception occurs, both the uterine lining and blood will be shed by the body as monthly process of menstruation. An egg is available to be fertilized by a sperm for only 12 to 24 hours, and in a given ovulation cycle, it is just one mature egg which is released. If the patient is trying for pregnancy, this is the time to have intercourse to get favorable results. Most women who have regular menstrual cycles will ovulate between day 11 and 21st day of cycle, counted from the first day of last period. However, this is not necessary and many women may ovulate at different times or different day of each month. This is why it is important to track the menstrual cycle and hence ovulation. What is a follicular study? The female reproductive system has small tissues called ovarian follicles that contain and release eggs for fertilization during each menstrual cycle. A follicle is a fluid-filled area in which an egg grows. The follicle increases in size as the egg grows. Follicular tracking involves scanning the ovaries regularly to see the size and the maturity during a menstrual cycle. It is a series of vaginal scans to help to determine when the patient will ovulate, the number of mature eggs that will ovulate, and to ensure that it is accomplished safely. When the eggs are mature, the patients are advised to have relation or intrauterine insemination or proceed with egg collection in case of in-vitro fertilization. Generally, these scans will start around day 9 of cycle and continue till day 20. That is around 8 to 11 scans. It is a vital process for getting pregnant, including through fertility treatments like IVF. How is a follicular study done? Performed via an ultrasound, a follicular study examines the ovarian follicles using a transvaginal scan. The doctor will be able to tell you the approximate time when the egg will be released, and thus a couple can plan intercourse at that time to maximize the chances of conception. The tissues contains eggs and the thickness of the endometrial lining are studied to determine the period that the patient is likely to ovulate. Who should get a follicular study done? Though any woman trying to get pregnant can get a follicular study done, it is frequently recommended as the first line of management for infertility couples who have not been able to conceive after having an unprotected intercourse for more than a year. Age of the woman may also play a significant role as good eggs cease to produce in a woman who are in their late 30s or 40s. The pregnancy rates can decline sharply after a woman crosses the age of 35. Furthermore, follicular monitoring may also be beneficial for women who do not know when they ovulate. In case of women who have irregular periods, of a woman who is not sure of ovulating at all, if she doesn't feel any symptoms such as little bit of pain or spotting or ache during ovulation, or if the woman is on drugs that are used to induce ovulation. Is there anything else that follicular study can help with? Yes, as a fact, a follicular study will also detect some other issues that might impede a pregnancy. Some of them include, it will help to determine the follicles that do not grow properly before rupturing, the thickening of the womb lining in conjunction with the follicular release, or follicles that do not grow at all or do not rupture at all during the menstrual cycle. All these parameters help the doctor to know and when things are happening and what is not happening. It makes it easier to identify the problems and thus impart treatment or corrective measures for the same. Follicular study. To summarize, Follicular tracking involves scanning the ovaries regularly during the menstrual cycle and observing the follicles as they increase in size. A follicular study examines the ovarian follicles using a transvaginal scan. The tissues containing eggs and the thickness of the endometrial lining are studied to determine the period that the patient is likely to ovulate. When the eggs are mature, patients are advised to have planned relation or intrauterine insemination or proceed with egg collection in case of an in vitro fertilization cycle. Generally, these scans will start around day 9 of the cycle and continue till day 20, that is around 8 to 11 scans. It is a vital process for getting pregnant, including through fertility treatments like IVF. For your benefit, this information and more is available on our website www.chennaiwomensclinic.com.